Kate, welcome to the podcast today. Kate Markland. Kate, you're a physiotherapist, you're a clinic owner, you're a mum, you're a business mentor, and you say you've guided countless clients and clinicians through complex situations. And since we spoke last, you've also pivoted. I hate that word, but you've changed a little bit in terms of what you're doing. I think it's through the experience that you've had through having a child. But yeah, tell us about yourself.
You're quite right, Andrew. I used to be a physiotherapist. I'm not anymore, but I used to be a physiotherapist. I used to own a number of clinics. So you're absolutely right on that. And then that transitioned into me mentoring other clinic owners. But what's dawned on me, and any other person that's worked in healthcare will probably resonate with this, or any other sector, is that people's stories are so vital. So 20 odd years of being a clinician and owning clinics, day in, day out, you're listening to people orally tell their story. Nobody comes into a physio clinic, well, 1 in a million come in with their story written out. Everybody comes in to verbalise their story, the story of their back pain, their shoulder pain, their stroke, their Parkinson's, whatever it is. They come and verbalise their story. And your job is to ask the questions to extract more information, because the answer to their problem is nearly always in their story. You've just got to get to the nugget of it.
Yeah.
And then what happened over time, you're quite right, I'm a mum as well, was I needed to help my son, or I wanted to help my son in a situation we were in. And so I just suggested, why don't we make up some stories where you're the hero of the story, where he's the hero of the story? So that's what we began doing. And he orated his stories. He can read, he can write, he can spell, but he just verbally told his stories. I scribbled down notes and then typed it up in the week. Grandad made images and we made him a little book of hero stories. Very, very private project, just for us to get us through a moment in time. But it's gained a lot of interest because his request was that we get to turn it into a real book rather than just a thing on my computer. So we did, we published it. And the interesting thing is the question I've been asked repeatedly in terms of really why does this book matter, because yes, it's a private project for us, is the skill of extracting other people's stories. So I've been asked again and again, how did I get a child to share his story? Which really surprised me. The first time I was asked, I did not understand the question I was being asked. And then it dawned on me that 20 odd years of being a clinician, that is all I've done for 90% of my working life, is extract people's stories and help them find the meaning or the important piece of information within that. So there's an opportunity which I am pursuing at the moment, which is to help other children, or other grown-ups help other children extract their stories and their imagination, so they can recognise they're the hero of their own journey and they can defeat sea monsters, they can handle the tax man, they can handle whatever it is they need to when they get into adult life.
And I mean, Kate, the industry that let's say either that you were in or you're in, as a physiotherapist, I mean, you were helping, at one stage, you were helping other business owners or other physiotherapists or healthcare practitioners to become more, I don't know, entrepreneurial.
More profitable. I mean, most people that go into healthcare want to serve. They want to give, but they give so much that it's a very one-way street. They're not necessarily getting their needs met. And the profit margins are quite often in the very service-based sector. So the physio clinics, the podiatry clinics, things like that. The profitability is usually very, very poor. And it doesn't need to be. It just tends to be that they're not counting, they're not understanding, they're not counting anything. So they're not knowing actually where their break-even point is. They're not knowing what the point is in which they are financially rewarded for the efforts that they're putting in. They're not knowing, they're not reverse engineering the marketing activity or even measuring what marketing activity is working and not working. So they're giving a service of helping people, but quite often to their own detriment. And I think one of the interesting things with what you're doing, Andrew, is that so many people in healthcare, they get sucked into the shiny penny syndrome of marketing, the next gizmo, the next widget, going to advertise here, we're going to do that, we're going to do the other, not tracking anything, but also putting more emphasis on sort of need more clients, and no emphasis on counting the buttons. And it's like, hang on a minute, maybe if you count the buttons, again, the buttons tell us, the numbers tell a story, just like a piece of music tells a story. And it's like, if you can unpick the story in your numbers, the answer, like with everything else, is quite often there in terms of what you need to do or what you need to stop doing. So yes, I spent a lot of my time when I'm helping other clinic owners in helping them just start some really basic data gathering and looking forwards. You referred back to the accountant, and I remember when it dawned on me as a clinic owner that I needed to start counting things and checking in and getting a grip of my numbers. I made a very simple spreadsheet and showed it to my accountant in terms of, how do I do this? And I was trying to forecast. I was basically trying to forward plan. And it was a really disappointing response I got. I just got, you're doing fine. And I couldn't understand it. I was like, I'm a tiny business. You deal with so many businesses. Surely my first attempt at this is not just fine. And then as time went on, I recognized that so many accountants are dealing retrospectively with serving the tax man and what happened 18 months ago, but you're in it now. You want to grip on the forthcoming 18 months or the forthcoming 18 weeks or 18 days even. And that was a real shift, a moment of recognition that I can't do anything about what's gone. Yes, the accounts might need to be done, but I can't do anything about that. That's gone. I can learn from it, but what I can do something about is the future. And if I start counting forwards and reverse engineering the future, then if I don't like it, I've got opportunity to change something. That's one of the biggest recognitions, I think, is starting to take control as a business owner of your future and the activities you need to be doing going forwards, and how to look at your financial forecast forwards, and how are you going to reverse engineer that you achieve what it is that you desire so that everybody wins. It's not just at your expense that patients win.
I think you're so right there, Kate, because so many accountants for entrepreneurs and businesses, especially small businesses, they're looking in their rearview mirror, and they're looking at what has happened in the past, and they don't have a dashboard. I find it so useful for business owners to have a dashboard to say, this is how well or how badly we did last month or in the last 6 months, but what are we expecting in the next 6 months or the next 3 months? We have a revenue forecast and an operating expenses forecast, and we have a net profit forecast. And if that net profit is a loss, we need to bridge that gap. We need to either make decisions in our business to reduce our expenses or to get more work in or focus on more profitable clients. So yeah, I think it's a common trend around the world. That accountants aren't operating strategically. They're just ticking the boxes or checking the boxes in terms of what's happened in the past. Kate, what is your first recollection of money, finance, those aha moments that you've had in your life from the time early days until now?
I remember 3 really particular incidents. And one, I must have been 3 or 4, because my brother was in my dad's arms, and we were allowed 10p a week. When we were kids, we were allowed 10 pence a week, and basically that got spent in the sweet shop. So we were allowed 10 pence a week of sweets, and my dad had taken us to the sweet shop. And so my brother was very little, because I remember my brother was in his arms, and we obviously bought whatever we'd bought, but my brother had clearly picked up something that we hadn't paid for. And so we're walking out the shop, and my brother's screaming his head off because he had something in his hand that we hadn't paid for. And my dad's trying to silence him, not recognizing that essentially we're stealing because we're about to walk out with, I don't know, whatever chocolate bar. Yeah. So I really remember that. I mean, what that means long term, I don't know, but I remember that. And then I remember 2 specific exercises. So I'd have been a bit older, I'd have been about 7 or 8. And I decided to catalogue, this is my first ever business, I decided to catalogue all my books. And I made them like a library. But to borrow my book, there was a price tag next to them, 5p, 10p, whatever. The problem was I had an audience of 1, my brother. And my brother was not interested in spending his pocket money on renting his sister's little girl storybooks. So that business completely and utterly failed. And I suppose long term, further down the line, it's, the lesson in that is understand your audience and whether they're actually going to buy what it is you're offering.
That's very true.
And then the second business, and I think this is one of the most powerful things I did at school. If I'd taken no other lesson than this, we were 10, 11. It was a very small village primary school, and we were going on a school trip, and there was a shortage of funds for, I don't know, whatever it was. I can't remember that part. But the head teacher's response to it was to give us all £1 each, to dump the problem on us. So we were all given £1 each with the task, and still have been about 30 of us in the class. And our task was to turn that money into as much as we could. And to my recollection, that was literally the guidance we were given. You've got £1 each, turn that into as much as you could. So we clubbed together. And initially there were 3 of us that clubbed together, and then a 4th person joined us because he didn't have another group to go. So we now had £4. And one of the mums belonged to cash and carry. Do you have cash and carry in South Africa, where it's big, like wholesale? You can get stuff cheap because they usually serve the restaurants. And so we were able to go to cash and carry with our £4 and buy some ice cream and buy some ice cream cones. And so we then set up an ice cream stand outside the school gates. And of course, they sold a dream. So then we'd got some more money. So we went back to cash and carry to buy some more ice cream and some more ice cream cones. And this time we were going to upsell some chocolate sauce or strawberry sauce for an extra few pence. And we'd got enough money to be able to do that. So again, we go and rerun our ice cream stall. This time we're able to make more money because we've got chocolate sauce and ice cream sauce. And we did really, really well. I don't think we won in terms of the number of people, the amount we turned our £1 into. But we did very, very well. And it was just real proof that if you've got a very simple product and ice cream at the school gates, you are going to sell. We couldn't fail, could we? We just simply couldn't fail. The reason, though, we didn't win as a group in terms of the most money we turned it into is because we'd gone to 4 rather than 3. If there had been 3 of us, we would have been significantly the group that had made the most profit. But we'd gone to 4 because we'd got a friend that was left out, which is fine. But again, the lesson in hindsight as you grow up on your business is, are you over recruiting? Because that will seriously impact your bottom line.
Are you recruiting? But the other side of that is, I always in my finance fusion workshops, I always talk about, if you owned a shoe shop or a shoe manufacturer, Kate's Shoes, and Kate wants to go global with her shoe shop. So Kate needs £1 million or $1 million to go global. Does Kate borrow that money, or does Kate get a partner on board? So that's a very almost like a dragon's den type of question, because there are pros and cons of both. So they say to borrow money is cheaper than to get a partner, even though you have to pay interest to the bank. But if you get a partner on board and you give that partner half of your business, you've lost 50% of your profit forever. Whereas the bank, you can pay back that loan and that interest. So it's a similar kind of situation, because you were 4 partners and not 3. And if you were 2, you probably would have killed it. So that's interesting. And Kate, tell us about your business at the moment. Are you not helping healthcare?
No, I still help healthcare businesses. I still help healthcare businesses, and usually the first starting point is getting their numbers in order, so that they've got a dashboard, they can see the wood from the trees, they've got clarity. And then after that, the next point is usually, right, who's your target audience? What's the story? Why are they going to be buying into your service or your offer? And then how do you make that meaningful to them so that they can understand it? But the starting point usually is, when I meet the clinic owners, is they're in absolute chaos because they haven't got clarity on how many of anything and what their margins are, and whether they're profitable, or what services are profitable and what services are costing them. And one of the other parts of that, Andrew, which I'm sure you've got views on, is that with more and more software in small businesses, data is available. And so sometimes I'm starting to see it, you'll ask somebody if they have the information. They have the information, but not in a format that you can analyze it. So my tendency is to go to Excel, in that let's put this in Excel. It might be on all sorts of softwares, but if we put it in Excel, we can see it. We can look at week by week. You can look at day by day, month by month, quarter by quarter, whatever. You can sort it out in a meaningful way in which you can analyze it. Whereas, and this could be just because I'm not tech savvy enough, I'm sometimes finding if data's hidden in systems, yes, you've got access to it and you can look at it, but you've got to be able to make meaning of it. And sometimes I relate it, because obviously, sure, you know how to read a cricket scoreboard. I have no doubt you know how to read a cricket scoreboard, but I often relate it to North Americans who are less familiar with cricket. But if you don't know how to read the scoreboard, you can have all that information in front of you. But if you don't know how cricket works, it's just meaningless numbers.
It's sort of like connections in the brain, isn't it? I know my engineering client, I help a client out for financial strategic reasons. The client has got an accountant, right? And that accountant uses an accounting system. And my client keeps on going into that accounting system to look at the revenue and the cost of sales and the OPEX and the net profit. It confuses and frustrates him because he doesn't understand it properly, and also he's looking at the wrong information. And it's a lot of detail as well. So what I've done is you talk about Excel, right? It's a swear word for some people, but Excel, I've created a dashboard so that he knows exactly how well he's done and how well he's going to end off at the end of the year. So I can tell him in any month, I can tell him exactly how much profit he's going to be on at the end of the year. So we can forecast cash, so we can pay tax, so we can sort out, things that we need to pay at the end of the year, so we can plan properly, and more importantly, to see what gap he's got in his business in terms of work. Because obviously, businesses go up and down, and when he's on a down, he needs to know he's on a down, and he needs to know where he's going to end up at the end of the year. So absolutely, Kate. It goes back to where we started the conversation in terms of, looking in the rearview mirror versus, looking in that dashboard. And a lot of people don't have that dashboard, and they are literally working out of the till.
A bookkeeper once told me how she viewed cash flow forecasts. And she said, because she was doing them, whatever business she was working in, and she was doing them daily. And then she said to me, she saw it like a piece of music, in that to begin with, it's going to be a mess. But what you're looking for is a rhythm. You're looking for the patterns and a rhythm, and for it to play nicely. And the more you keep going with it, just like any musician, the better it's going to play. And I thought that was such a beautiful analogy, because it kind of took the fear away of things been lumpy bumpy, because it's going to be, if you sit down at a piano and you haven't played for a long time or can't play like me, it's going to be a mess, but it's only going to get smoother by you engaging with the process.
As you learn, you make mistakes, you correct things, and eventually it does become smooth. That's right. Kate, just to go into your clients, what would you say the top 2 or 3 issues that your clients have with not just with money, with finance, with accounting, with driving their business?
I think the first one is the amount of hours they're working. So they're not and gosh, I was there. Most people have been through this point. If you're a business owner, the day you realize that you're earning less than anybody else, or the day you realize you're earning less than the cleaner, because if you add up how many hours you're putting in for everybody else to get paid, so you're working for nothing. Clients are getting served, your team are getting paid, but you are taking home next to nothing. So I think that is the biggest issue. And I think that is often the driver when people have that realization of, hang on a minute, what is your actual hourly rate? You'd be better off being employed as a jobbing physio than having your own clinic. that's often the trigger that leads people either to want to sell and get out, or just shut the doors, or do something about it. And quite often, if you get clarity on those numbers, it takes the pain away. So there's a lot of emotion tied to difficult decisions, such as when you realize you're in that position, maybe you need to close sites, maybe you need to let some staff go, maybe it's a combination of both of those before you can then get the healthy stuff growing again. But if you've got clarity of the numbers, it takes the pain of the decision away, because it's just obvious what you need to do. And then it makes it emotionally a lot less distressing. So I think the two big, well, it's all probably all one. It's your emotional relationship with the business, which has essentially become like a child, hasn't it? You've birthed it, you've committed to it, you've put all your life and soul into it.
Yeah.
But it's perhaps not serving you, it's perhaps consuming you more than you wish. And so getting the reins back on that, and if getting the reins back on that means that, some stuff needs to be chopped off, then, or let go of, or changed, then the clarity on what's profitable and what's not profitable gives the opportunity to unemotionally decide what to let go of and what you just need to it's either manage up or manage out, isn't it? You're either going to manage it out or you're going to manage it up so it is profitable.
Yeah. But I think it also, goes down to your purpose.
Yeah.
Does not, I've run a few strategic sessions for some clients in the past where it's like, why are we here? As business owners, what do you want? What do you want to end up? You want to sell your business in 5 years at a certain profit? Or do you want to make tons of cash now and just let it go bust? Or do you want to, or is your purpose for a higher cause, and it's not about the cash, and it's about to serve, and it's about employing others and allowing others to earn? I guess it does boil down to purpose. I'm surprised I'm saying this, because I'm always drumming into people in terms of improving your profitability. That's why we run Finance Fusion courses, is so that companies can improve their profitability. But at the end of the day, that's if they want to improve their profitability. There needs to be that burning desire to do that, or are they there just to surf and let other people run their business, and it just pays for their lifestyle, and they don't really want a lot of cash out of it at the end of the day.
Yes, and I think you're quite right. It's what's the purpose, and what's it's back to what's your relationship with your business. Because if it's meeting your purpose and you are free to go surfing, then great. But if it's meeting your purpose, or you feel it's meeting your purpose, but you're completely sacrificed, then that's not okay.
Yeah. I think too many of us treat our businesses as hobbies. Because I think you enjoy what you do, and I'm enjoying what I'm doing. It's a bit of a journey, and it's an entrepreneurial or solo entrepreneurial journey, and it's I've made so many mistakes as well, as we all do. They're learning points. But yeah, Kate, just to close off, what would you say? What would you advise entrepreneurs to improve either their relationship with money, or improving their businesses, or to become more profitable? From your experience with your clients, what would you say would be the most beneficial information you could give to your clients to improve their profit?
You've got to find somebody that you trust, that you're willing to open Pandora's box with, because you can't, when you're consumed in it, you can only see from your perspective. And with all respect, you created in all likelihood the monster that's now sucking the living daylights out of you.
Yeah.
So you've got to find somebody who's going to be able to see the wood for the trees for you and have a look in. So I really think the number one tip is you need to accept that you need to open Pandora's box, so that and you might not like what you see, but at least you've then got a mark in the sand. And you need to have somebody come alongside you that's probably going to have a different perspective to you. So their strengths are not your strengths. Their strengths are perhaps like Andrew's strengths. Their strengths are complementary, but not, you're not just, because if you just go find another one of you, you're only going to hear what you already are hearing. You're not going to get that other perspective. And then with that other perspective of a trusted person, you can really have a look at what is actually going on and make some really sensible and clear decisions whereby your purpose is being met, but not at your expense. And that can be expense in terms of energy, sleepless nights. It can be expense in many, many ways. It's not just figures on a spreadsheet. It's
I think it's all about preventing those surprises. And you might have one surprise, or you have a whole lot of surprises all at the same time. But from now on, let's get it right. Let's get rid of who we need to get rid of. Let's hire who we need to hire. Let's close the business if we got to close the business. Let's get rid of or decline the services that we're providing, which are not giving us any profit, and let's focus on I would say the profitable clients or patients, and the profitable services as well. Kate, thank you so much. It's been great chatting to you again, and we'll stay in touch.
Thank you very much for having me, Andrew.
Thanks, Kate.